PAHO pleading with Caribbean countries to get vaccinated, the Minister of Health shooting down fraudulent claims, and the owners of Canoe digital payment provider have found themselves caught in a controversial matter. Good evening, everyone. I'm Tyler Simonet with your Jcn News for this Friday, August 13th. Thanks for tuning in. The Pan American Health Organization making a desperate plea to Caribbean nations where vaccine hesitancy has been on the rise. Director of PAHO, Dr. Carissa Etienne, expressing concerns as she says the Caribbean region has the highest coverage of routine vaccines, but now persons are not coming forward to receive COVID-19 vaccines where they are available.
I want to make a special appeal to my fellow Caribbean persons to please, we have to be extremely careful. We have limited bed capacity and limited ICU capacity in our small islands. We also, in smaller islands, we have limited expertise in terms of the number of healthcare workers, the number of respiratory therapists, the number of anesthetists. And our health systems will become overwhelmed very quickly. I don't know the sources of the information that is triggering this level of vaccine hesitancy. I can tell you that they are not scientifically proven.
Dr. Etienne urges the Caribbean public to listen to sources where they have scientifically based information and evidence. She also gives these statistics on vaccines.
The vaccines work, and the proof that vaccines work, particularly those that received emergency use listing from WHO, it's because in the cases that are now hospitalized, that's in severe illness and deaths, more than 95% of those have not been vaccinated. To be protected, you need to receive the full regimen. If it's 2 doses, you need to receive the full doses. 1 dose does not protect you. And please, the best vaccine for anyone is the one available to you. So please make use of vaccines that are available.
She also says that it is still important for people to adhere to public health measures as they are put in place to save lives. So far in the Bahamas, at last report by the National COVID-19 Vaccine Consultative Committee, fewer than 50,000 people have been fully vaccinated against COVID-19. Health Minister Renwood Wells did not receive any of the funds allocated for the honorarium put aside for frontline and non-frontline workers who gave their service during the height of the COVID-19 pandemic in the Bahamas. The Ministry of Health, in a statement, shot down claims circulating on social media that Minister Wells received an honorarium payment of $10,000 for the COVID-19 response. Social media reports also suggest that the minister's driver and personal assistant received $5,000 each for their contributions to the COVID-19 response. Health officials categorically denying the assertion that these employees were dispersed the same minimum honorarium payment issued to non-frontline workers, adding that the amount awarded to these persons was $1,158.40. The ministry reminds that the honorarium payment is a promise the government made during the 2021-2022 budget debate, intended for a subset of frontline healthcare workers who were the early heroes in the COVID-19 fight. These workers willingly responded to the call, offering their name and talent to initiate the COVID-19 response when the majority of healthcare workers were hesitant and declined to serve. These frontline workers, some working in clinical and non-clinical settings, served during the period of March 19th to June 18th, 2020. The ministry says the information circulating on social media is false. Shadow Minister of Health Senator Dr. Michael Darville slamming the government's handling of the COVID-19 honorariums. In a statement, Dr. Darville claims that persons not directly involved in the fight against COVID-19 reportedly received payments, while some frontline healthcare workers were not compensated, and that this decision has worsened the healthcare crisis with sickouts and threats of industrial action. This, he says, raises serious alarms over the government's management of the country's public healthcare delivery system. He says the response by the Minister of Health that the honorariums were earmarked for selected frontline healthcare workers in the fight against COVID-19 failed to address or clarify allegations made by Public Hospitals Authority staff that personnel in the Ministry of Health's headquarters received honorariums. The opposition urges the government to move with urgency in addressing the lack of capacity, the poor physical condition, and the unacceptable working conditions at the country's healthcare facilities, as well as the discontent within the ranks of the Ministry of Health. Dr. Darville contends that the government must inform the country, and particularly the families of the impacted healthcare workers, about the corrective actions being taken. The owners of Canoe digital payment provider have found themselves caught in a controversial matter regarding the travel health visa program, which they say has nothing really to do with them, as they are only providing a service to the government. One of the founders of Canoe appeared on Love 97's radio talk show Issue of the Day with CEO and host Wendell Jones on Friday to try and help the public understand their role in the travel health visa program. Drino Saunders has more in this report.
Principals of digital payment solutions provider Canoe continue to try and educate the general public on their relationship and involvement with the COVID-19 travel visa program. The company has come under attack, especially on social media, over the past few months, and has been accused of being a front for special interest groups to benefit financially from the visa program. Chairman and co-founder Nicholas Reese reminds that the company is owned by a group of young Bahamians. He says Canoe is being unfairly accused of wrongdoing.
Innuendos continue to be made that Canoe is a participant in this program, whereby we have designed this program. We're benefiting excessively from this program. On the show was mentioned that this was a rape of the country. This type of terminology and referencing to Canoe's involvement is not only factually incorrect, but it's defamatory and it's counterproductive to what we're trying to do and what we have actually brought to market. And I think that there exists a lot of misinformation in the public as it relates to the services that we offer, who Canoe is, what we do.
In June, PLP leader Philip Brave Davis promised the PLP-led government would end travel health visa requirements, describing it as an unnecessary tax. Mr. Davis was also critical of the government's decision to award Canoe the contract to collect funds on behalf of the government and hold those funds in a Bank of the Bahamas account. Mr. Reese says Canoe has been increasing its public relations efforts to help Bahamians understand what they are about. He says the company does not get involved in politics and was recommended to the government by a private Organization for Responsible Governance. And that recommendation was done to assist with the payment portion of the travel visa program, from which they receive a 1% service fee for each travel visa, which works out to about 40 cents for the international travel visa and 20 cents for the Family Island travel visa.
That's basically what we're saying. We are the smallest, most insignificant piece to the travel visa program. Why is it that Canoe is being attacked? It's because of our technological innovation and those of the oligarchy that own and operate some of these other financial institutions that have actually been the ones getting the favoritism. And so our disruptive technology is now a threat.
No, it could be that Canoe is attacked because there is a whole lot of misinformation in the public domain, and because Canoe itself has not done the public relations to say what your involvement is. And now that you are here and you are explaining to the public what your involvement is, it is greatly appreciated.
Mr. Reese says the reason the government chose Canoe is because it was the only company in the country that could do what the government needed to be done in such a short time because of the effects of the pandemic and the need to open the economy. Asked to give his opinion on why he thought the travel visa was necessary, Mr. Reese explains that Canoe does not get involved with policy decisions by the government.
I don't get involved with either party. I support whatever the Bahamian people put in power. Right? So that is a political question and a political response that myself and my company would not be involved in. If the travel visa program closes tomorrow, not an issue, no problem. We have a business, just like we service Super Value, we service the travel visa program. Right? So I will leave it up to the Bahamian people to decide how they feel about the program. However, it has been touted and it's been communicated that it has been successful in
Mr. Reese is asking the public not to try and tear down the legitimate company owned by Bahamians because of misinformation and intentional propaganda during the political season. Chirino Saunders for JCN News.
You're watching JCN News. Stay with us.